I'm Dr. Vineeth KK. I'm a consulting neurosurgeon at Blues Hospital, Kochi, Kerala. Today, I'm here to discuss the topic epilepsy and seizure. So I think we'll straight away move on to the topic. First of all, what is epilepsy and what is seizure? To define epilepsy, it's a neural disorder which affects the brain, and it's a tendency to have repeated seizures. So what exactly these seizures are? So, our brain controls in the four neurons. Neurons are different nerve cells that forms part of the central and peripheral nervous system. So there are millions of neurons in the body. So these form networks and fire chemical messages to make our bodies work properly. So sometimes these neurons may misfire and chemical messages mix them. This can cause seizure. So epilepsy, as I said, is a tendency to have repeated seizures. This tendency can be long term, but the seizures can be controlled. So a person can have epilepsy, but they may not have active seizures. So talking about seizures, seizures are brief and sudden disruptions to the electrical activity of the brain. So they start in part of the brain or happen in both sides of the brain at once. What type of seizure happens depends on where in the brain misfire has happened. That is, you have different kinds of seizures and obviously different kinds of epilepsy. So, as a layman or as a patient, it's not very worthy to know what kind of seizure, what kind of epilepsy, because those are medical terms. But you must be sure your doctor, the neurologist, or the neurosurgeon gets a proper diagnosis what kind of seizure, what kind of epilepsy you have. So, talking about how one knows if one has epilepsy. So, as a patient, when you first have a seizure, you may have to take to the hospital. So, if you are in the right hospital at the right time, you may have undergone a series of investigations why the seizure has come. That includes a proper thorough medical history and a clinical neurological examination, followed by problem electroencephalogram or EEG, and thorough imaging of the brain, CT or MRI. Following which, in many cases, focus of seizure, focus in the brain would be discovered, which started off the seizures. And in almost 50% of cases, you don't find an exact focus of cause of seizures. So those are called idiopathic seizures and epilepsy. But in the kind cases of patients where the cause of seizure, the focus of seizure has been isolated using the imaging and EEG, then it's easier for the doctor or the neurologist or neurosurgeon to follow up the patient and give the right kind of treatment at the right time to the patient. So remember, anyone can develop epilepsy at any age. Your first seizure may occur probably even an age above 70, which is definitely rare. But even then, you may be diagnosed with epilepsy at that age. And try to get as much information as possible from anyone who saw the seizure. In most of the cases, if you are a patient with seizure or epilepsy, you may not be aware of the duration or the way you presented the seizure. So most of the cases, the person who was around you, with you, would be more helpful. And also in today's world, taking videos, like if you're in an isolated area, even closed circuit cameras can help the way of how you present the seizure. So videos can be helpful nowadays. So once epilepsy is diagnosed, what are precautions as a patient need to follow? The first thing is epilepsy is not contagious. There is belief in at least some parts of the world that epilepsy seizures contagious. You have a patient or a person with epilepsy seizure, you go near him, you get the disease as a contagious like an infection. That's absolutely wrong. That's baseless. There is no scope for contagious spread of epilepsy. But seizures can pose risk to safety. You may be driving, you may be in heights, you may be alone, unsupervised. You throw away a seizure, and then can result even in hazards, even death or permanent absence. So that's why with the first step of seizure, I think you have to have a background investigations, thoroughly evaluated to know whether you have a tendency to have second or further episodes of seizures. Sometimes once you diagnose a seizure epilepsy and you're prescribed medications by a neurologist, you have to follow the medication strictly. Never stop taking, and even more, never even change a dose, skip a dose of your medication. Follow it as religiously as you can, as per the doctor's prescription. It's a common reason why some people like throw seizures even after being diagnosed with epilepsy is that they don't follow the medications strictly. Maybe the duration between medications not thoroughly followed. Those may be altered or they may even stop. So the things you have to know it triggers why you get seizures. Many people throwing seizures as such without a trigger, but there are some known triggers like flashes of light, or long periods of not having a food or sleeplessness or taking too much alcohol, so and so. So whatever trigger you have or you have had previously which caused the seizure can again produce the next episode. So you have to know your triggers and then change your lifestyle accordingly. And if you're not sure, definitely take the help of a doctor because he can help you. Obviously, with another bystander who knows how you proceed with the seizure. Then about the side effects, any medication can have side effects. Obviously, the anti-seizure medications can have a lot of side effects. But over time, over the long periods of years, there have been newer alternative medications which presently lesser side effects than the previous generation medications. But definitely, any latest anti-epileptic prescribed to you may pose risk for certain side effects which the doctor can help you with. So you have to be aware of them. And then the people who have a tendency to have recurrent seizures, it's always safe not to drive. It's always safe to avoid driving. Then next, one question is epilepsy, whether it is curable. So when you talk of cure to disease, it's like you get an infection, you have an antibiotic or so and so, what medications, you get completely rid of the disease. That kind of cure is unfortunately less common as far as epilepsy is concerned. Definitely, with medications, you can have a healthy lifestyle, with complete control of seizures. You can know when you can have seizure, when you tend to have seizures, and you can control it completely. And about stopping of medications, generally as a consensus or as a protocol worldwide, if someone is seizure for 10 years and off seizure medication for 5 years, the epilepsy can be considered cured. And regarding treatment options, apart from the medication, definitely we can think about epilepsy surgeries, which have been uh, more known recently. So previously there have been more invasive ways of surgery to get into epilepsy, but the results were lesser. Nowadays, this is definitely not 100%, but in many of the cases, epilepsy surgeries, minimally invasive epilepsy surgeries with proper facilities and proper equipment can help in a seizure-free life lifelong in most cases. In many cases, you can get rid of medications after a few years after epilepsy surgery. So epilepsy surgery is a different way of treatment apart from medications. Other ways like stimulation, vagus stimulation. It's a form of surgery, but not very invasive. Where the people who seizures are not handled with medications or may have failed surgery, do not want surgery. So this therapy can be opted. Here, just like a pacemaker, we have a device with a battery placed under the skin of the chest wall on the left side with a wire attached to the left vagus nerve. So the stimulation of vagus nerve will reduce the frequency and intensity of seizures with subacute epilepsy. So people with multiple comorbidities who are not fit for a major surgery can opt for this therapy. Then ketogenic diet therapy, which has been recently advised, but usually not a complete cure, but can, with extremely low carbohydrate and high fat diet, may may help patients respond to epilepsy when they have other treatments. Then, so about that, can someone with epilepsy lead a normal life? Yes, definitely. With the right sort of medication, the right dose set by the neurologist or specialist doctor, you definitely lead a normal life. Any aspect of life can be led normally. You don't have to compromise any of the aspects. Next, as a caregiver of patient, what information you give to the doctor for the correct diagnosis? So, as I said, diagnosis made by doctor, can be neurologist or neurosurgeon, or even a general physician, taking account of the prescription, which is proper clinical history and thorough clinical examination. And in many cases, the bystander, the caregiver may help you with the exact semiology features. By semiology, what I mean is the duration or what was the trigger and what kind of seizures, whether you fell unconscious and whether seizure affected the whole of the body or parts of the body, whether it was unilateral or whether you were knocked off or whether you were just staring at someone and that was diagnosed with seizure. What kind of seizure you had? Some description as much as possible should be given to the physician or the medical personnel to help diagnosis of the exact form of seizure or the epilepsy. So, as I said, witness accounts and videos can be really helpful. Some cases, genetic factors, as I said, epilepsy is not contagious, but with a family history or a genetic history, definitely epilepsy can occur along generations. So, as caregiver, you also have to help the patient elicit proper family history. Like In small piece of relevant information can be of great help. Then moving on to the other queries regarding personal life. Can a marry if I have epilepsy or can you children if you have epilepsy? Yes, most men and women with epilepsy will be able to have family if they choose. But certain medications have been linked to lower fertility in some women and can cause trouble in conception. So it's important to discuss with your doctor, your caregiver, the doctor personnel about the medications you're taking if you're planning pregnancy. So access to good medical care is important before and more important during pregnancy. If you're planning a pregnancy for women, it's advisable to speak to a neurologist or epilepsy specialist. And as I said, you can even change the dose or the change the medications. This can pose risk to you or the fetus. Then most women have healthy pregnancy, healthy babies while on medication. But this preconception counseling and antenatal care is very important. Even after delivery, the first 6 months where you have to take care of the baby 24 hours round clock, and you have to breastfeed. In all these cases, the medication, what medications you take, when you take, and whether you have the tendency to have seizures, specified medications, all these are important regarding the antenatal, natal, and postnatal periods pregnancy. Then, if as a patient you are unable to tolerate your anti-infectious medications, like as I said, there are more than a dozen kinds of medications. So, uh, certain medications are given to you in tighter doses, whereas the neurologist or physician starts the medication at particular dose. You may throw seizures even in spite of having medications at that particular dose. Then the doctor may either change the medication, like add on another medication, or even change the dose of the medication. So if you're unable to tolerate the anti-social medications due to potential side effects and other problems like drowsiness, sedation, nausea, unsteadiness, and even behavioral disturbances, which can affect your personal life, then the doctor can help you with that. And as I said, can change the dose or change the medication. As such. Chronic side effects may occur when drugs are taken on long term. Some patients may have lifelong epilepsy, lifelong, they may have to take drugs. In that case, there may be chronic side effects. All these should be discussed in detail with the caregiver and the medical personnel. About the importance of diet and lifestyle and medication adherence. Self-management and self-care describe ways in which a person with epilepsy can take control over the lifestyle and emotional impact of their condition. So this can be done by reducing and avoiding triggers and also by increasing the personal wellness and coping skills. So getting regular meals and exercise is very important. Like starvation can pose as a trigger to seizure. Regular exercise is recommended for physical and mental well-being. Recreational activities are good, like yoga, mindfulness, meditation, stress management exercises, etc. More and very important, as important as these are proper healthy sleep. If you have problems like sleep apnea, lack of sleep, again, your doctor can help you with getting a healthy, proper sleep. And also, timely sleep is also important. No doctor can. You have to change your lifestyle accordingly. While talking about the importance of medication adherence, anti-epileptic drugs are the most common way to treat epilepsy. So, adherence to the medication is of paramount importance to achieve cure or control of seizures. You need to take multiple drugs at the same time or different times because the level of the medication, level of the drugs in your blood peak or should be the minimum required level round clock. So your dosage will be according to that. So this should not be skipped. Any skipping of even a single dose can result in reduction in blood levels of specific medication, and that can pose to have a much sensitive episode. So you should never stop the treatment suddenly without any guidance from your doctor. Then also switching between different brands can even pose risk because certain brands may not be functionally equally good, so they may have decreased quantity of the content. So it's always advised you have to follow the same brand as long as you have a proper control of the seizure. So the drugs which are perfect for you as the prescribed doctor, uh, be more specific to get the same brand of drugs so the content or the quantity of the medication is not compromised. So, to conclude, there are some general do's and don'ts for the patients and the caregivers. So, as I said, get enough sleep, avoid alcohol, at least avoid excess alcohol and recreational drugs, avoid late night outing, avoid driving particularly solo driving when you are prone for weapon seizures. Healthy diet, the manage stress, take medicines regularly and exactly as prescribed. Then some don'ts. You have to, as I said, you may be in heights, you may be in water when you throw a seizure. So swimming alone without supervision, climbing stairs and climbing to bigger heights without supervision can be dangerous. Extreme sports like skydiving, scuba diving, all these may even act as triggers for seizures and particularly unsupervised can result in hazardous uh, consequences. In operating or driving heavy machinery which can pose risk to your life, those are not recommended for people with recurrent seizures or epilepsy. It's not working at heights. And for parents and guardians, that is caregivers, the main do's and don'ts are that first of all, you have to accept your patient, maybe a child or your relative. They have to accept child as they are. The unique person who happens to have a disease called epilepsy, which is definitely controllable or even curable. So listen to them, let them know you support them, build their confidence, and do focus on what they can do rather than what they cannot do, and offer practical support by helping them do driving or certain special activities, even in jobs which are unskilled. And we see them as a valued as always because the patient with epilepsy definitely has a lot of insecurities. So this can even affect his character, his life activities, everything. So it's always good to have a caregiver who knows in and out of the patient. So be with them, reassure them, and don't encourage them to see epilepsy, barrier to doing something or to see themselves as less able. And don't restrict your family life unduly because of the child's epilepsy. Just lead life normally with proper medication, proper care by the special medical personnel. So don't be overprotective. Don't exclude your children or close relatives or let them feel isolated. Don't give them feel that they need to be isolated. They need to be taken care of as special children or special persons that can uh, detriment. So these were the different aspects for about epilepsy and seizure. Hope I covered all the basics necessary, particularly for layman or patient or caregiver, or for a non-medical person who know about the seizure and epilepsy. So that was my talk. Hope everyone has had a good time. Thank you for patience with me. Thank you.